My name is Phyllis Peacock. I'm 58 years old. I live in Durham, North Carolina. At this time, I am employed part-time. I work for Community Wholeness Venture, which is a nonprofit. I'm single, and so my son lives with me right now. My household income is approximately $22,000 per year. I am not currently insured in any aspect. No, nothing, zip. In 1995, I was diagnosed with breast cancer. At that time, I had health care, sort of like an 80 to 20%. Well, since that time, I no longer have any kind of health care. Even with my insurance, I was left with medical bills ranging between $20,000 and $30,000. It has really been a really hard time paying those bills, and I have not been able to pay them all the time. So that's had an impact on my credit. That's also had an impact on my, self-esteem. When I had surgery, I was in the hospital for like a couple of days, and then I was sent home with a tube hanging out of my breast for drainage. Even though my doctor wanted me to remain in the hospital for some more days, the insurance company said that, it would not pay for it. In 1995, that's when it happened. And of course, there was a couple of years, when I had to have chemo and radiation. But when I go to the doctor, it's not about cancer or breast cancer. It's about, just ordinary health care, a physical or, a lab test. It's just about ordinary health. It's not about cancer. So, if cancer was an issue at one time and now it's healed, it's no longer there, then why is that pre-existing condition even in the picture? And that just reiterated that, it wasn't important to them, that my life is not important to them, or my well-being is not important to them, or other people's well-being is not important to them, that it is all about the bottom line. It is all about money. It is all about power. I would like for them to work with the doctors instead of against the doctors, I would like for them just to treat people fairly, when it all comes down to it. Just treat people like they're human beings and not numbers, and not numbers on a bottom line, but just treat people like they're human beings and like they'd like to be treated. That's what I would like.